If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome everyone to Health Further. Today we have another great guest episode. As you know, we've been really digging into AI and where are we getting traction in the healthcare space using AI to really make a difference. And today I have Carlos Rodriguez here from Humanate Digital. Carlos, thanks for doing this.
Yeah, thank you, Vic. I'm so looking forward to this. Thank you for inviting me, and I look forward to the session.
Yeah, it should be fun. I want to disclose up front. My fund, my venture fund, Jumpstart, does have an equity position in Carlos's company, Humanate Digital, but he is really one of the leaders in AI in healthcare. So we wanted to bring him to you. So Carlos, as we get into this, maybe give the audience a little bit about your background as a place to start, sort of how you came to this wild world of healthcare AI. I think from a much more traditional healthcare background.
Yeah. So I always start, I was born at a very young age. Yeah. But no, my background educational wise is I'm an engineer, picked up an MBA afterwards. And really, I kind of cut my teeth with a Bain and Company, and that was very heavy in M&A in telecommunications. And this is back in the kind of early 90s and 2000. And Vic, it was just amazing, having worked for Bain and Company. They really taught me a lot. But one of the things they taught me is I was in charge of mergers and acquisitions, and my specialty was the cost of goods sold. So when we're looking at buying a company, if it had more than 20% labor content, we either said we need to automate it or we need to offshore it, right? So that was the principle that the labor was such a big part of our cost that you needed to manage it. Well, turn the tables. A few years back, my wife gets diagnosed with stage 3 breast cancer, and being an engineer, I'm trying to figure it out, and a lot of it was because there was no transparency when it came to mammographies back then. It was the days with X-rays, and it was very difficult to carry that X-ray from doctor to doctor, before portals.
Yeah.
Therefore, whenever we went to a new radiologist, because we lived in a new town, they would not get the baseline mammogram, which is how you catch breast cancer, because it's really the mutation of healthy tissue. As you age, it gets unhealthier, and that's what you get. So when that happened, I said, you know what, I would like to change this. So my first startup, that sold a 25x to private equity, was coming up with the first cloud-based, all-digital release of information company when it came to medical records. And my goal was to get rid of faxes. Out of
we're still working on that today. 20 years later, we're still working on that today.
And what's funny, Vic, is I would go to Office Depot and Office Max, and I could no longer find faxes for our employees to purchase. Yeah. And they would say, Mr. Rodriguez, the only two industries that still use faxes is flower shops and healthcare.
So surprised about flower shops. I didn't know they were
because they get a lot of orders. This is before before people would do it digitally. So we kind of came up with an all digital platform, and it just grew like crazy. 4 employees to 400. We were able to get UCSF, University of Kentucky Medical Center, Texas Tech, and it really grew a lot. So that's kind of I cut my teeth inside of healthcare. But to answer your question, so now I'm in healthcare, working in the Texas Medical Center, and I become the COO of Baylor Healthcare, and I find out that 70% of my cost is labor, right? And I'm trying to figure out, how do you do that? Because I was good at cutting supplies and negotiating with vendors, but really, how do you deal with labor? The fact that in healthcare, for every one doctor in the hospital, you have 8 to 10 staff members. For every doctor in a clinic, you have 1 to 4. So
it's hard to even find the people. Never mind cut the cost. You can't even find them at any cost, really, typically.
And that's really the realization, right? So once we hit COVID with the startup company, it was so difficult to find people. And a lot of my peers were making the mistake of using the government's money to just throw it at people to try to retain them. And it wasn't done in the way of bonuses when the money ran out. So you inflated labor by a good 20 or 30%. So I'll give you the example. Most people in the front office, medical receptionist, people that that do scheduling and continuity of care, they're probably making $15 to $17 an hour. Now you can't hire anyone over under than $20 an hour, and even then, they still have to pass the drug test. They still have to be able to be fully immunized, and it does become a constraint of labor.
Mhm. Yeah. Yeah. And so, what was the origin story for Humanate? How did you think to do, so your company's called Humanate Digital. How did you come up with the idea, or where did it start?
Yeah, so as I started my company, I moved from Houston to a college town, which is College Station, the home of 80,000 students at Texas A&M University. And I started going to my primary care doctor. And Vic, in my 12 years in this town, about 200,000 people, the average wait time to see my primary care doctor is now 22 weeks, right?
Yeah, that's crazy.
22
It's
weeks.
true everywhere. It's true in a lot of parts of the country. Yeah.
And when I'm in front of my doctor, I'm with him less than 10 minutes, and half the time he has his back towards me
Yeah.
as he's typing my answers. And I just figured there has to be a better way because, think about that. If you can't see your primary care in 22 weeks, who's the person that really knows you, then you almost, when you get sick, have to go to a walk-in clinic or a minor emergency.
Mhm.
And honestly, those folks might not have your records. They might not know your history, right? And it's just not the way to do it. And then also the inconvenience that certain folks need their medicines, refilled, but the doctor hasn't seen you in a while. So now he can prescribe them, right?
Yeah.
So there's starting to be a huge imbalance between access to healthcare and then supply. So I really thought that automation was the way. Why not automate it? You kind of see that in the banking world, you see that in the airline world. So I kind of felt that it was the perfect one. And it's kind of funny because we looked at Indeed.com and found out that Bryan College Station was trying to hire 54 medical receptionists. They all had to be bilingual. And I went and talked to a couple of professors at A&M and said, surely we can come up with a way that we can do self-registration without a human. So that was really kind of what put us on the map, is the fact that we came up with the first medical receptionist that can speak 100 languages, and you can check in using your phone.
So that was the first concept. Let's try to do a medical receptionist through AI. Is that right? Where you interact with an AI, and it does the same thing the receptionist would do. And you said 100 languages?
100 languages. And then we're also the only company that has been certified the American Sign Language. So we have an actual avatar that I'll show here in a second that she understands sign language. So kind of our experience is you go up to a screen or a computer or an iPad. Cassie will greet you and say, "Hey, I'm Cassie, the clinical care concierge." Once you say your name, she remembers your name and starts speaking the language that you speak. So even if you bring your mother, who might be Pakistani, or your mother that might be Guatemalan, Cassie is able to speak to each one of your family by their native language. And that is huge when it comes to filling forms that have to be accurate. And that is huge also when you're describing what's wrong with you. Or in our case, we go ahead and also do a health and physical if that's what the doctor wants us to do before.
I mean, it makes sense that Cassie she doesn't call in sick, and she doesn't get impatient. She doesn't have a bad day. So you're live with a couple customers I know. Do you have a case study or like a way to describe how this affects the practice?
Yeah, so I read a statistic the other day, Vic, that just kind of floored me, and that is that I remember that Americans, we hated our cable company because they never answer our calls when we needed them.
Mhm.
Well, now healthcare has surpassed cable companies because one out of every three phone calls that you make to your doctor or healthcare provider does not get answered. And the reason is that they don't have a digital access, right?
Yeah.
And you have to call by phone. And even to make an appointment, you get bounced around three, four times because it might
Yep.
be that a different doctor has a different scheduler, right?
Right.
And the person that you talk to has not the authority to book Dr. Smith on Wednesdays
Right.
at, at 2. So that's kind of what we did is we
Okay, so
said,
it's not just when I walk in, it's also I could phone in or even I guess online and Cassie would help me.
yeah, so I'm about to show you a couple, what we did. It was our first customer, very busy orthopedic sports medicine practice, about 80 orthopedic doctors in the suburb of Dallas called Frisco. Um, and when I spoke to the CEO, he was concerned that he was getting bad ratings from patients when it came to receiving their medical records on time, their imaging studies, such as x-rays. And then also one thing that orthopedic doctors do is they have to fill a disability form for you to refile it with your insurance to get benefits. So whether you break a leg playing pickleball, you get hurt at work and you do workman's comp, or you get hit by a semi, all these things generates an FMLA form or a short-term FMLA form.
Mhm.
Well, the government mandates that this form you can only get reimbursed $25. So it was very hard to get doctors and nurses
Mhm.
to sit down out of their busy schedule
Yeah, so
and
the patient needs this form, but it's not reimbursed at a significant level. So it takes them more effort than it's really worth to do. But maybe you're going to tell me Cassie can do it pretty quickly.
absolutely, because this is the beauty. In '08 and '09, during the Reinvestment Act, uh, the government came up with a requirement that every medical record had to be meaningful use, and there was like 14 criteria.
Mhm.
And one of those 14 was it had to be machine readable without needing a human access. Now, people didn't take advantage of that. Now, Epic sure did, and Cerner tried. But we're using that to our advantage, especially now that the interportability and information blocking rule has come about, right? So now I can access a medical record as long as I have permission from the patient or the patient's representative if they're underage or filled the HIPAA form. So check this out. I now can go into the EMR, Cassie, because she's AI, and really copies or scrapes all the DRG and CPT codes, fills the form, sends it to the human in the loop because we are advocates of having a human in the
Mhm.
loop with AI. That person reviews it and then slides it into the workflow for release. So
Yeah,
we're
so
cutting.
now it's $25 for a 3-minute review as opposed to $25 for, I don't know, 40-minute to put it all together.
Correct. So let me share what that
Yeah, so
looked like.
what's the case? So there's an orthopedic practice. You have something you want to show?
Yes,
Yes.
correct. So again, the CEO has been very kind to us to be able to use them. So this is the Carroll Clinic in Dallas. Very busy from 8 to 5. However, most of our healthcare happens around 24/7. So especially now with two members of the family working, we come home at 5, and that's when we really start thinking about, hey, little Johnny needs a physical, or I need to go get this.
I gotta
But
get this. I gotta get this form. I gotta get this FLNA form for my. Yeah.
correct. But by that time, everything is closed, right? So the staff was also overwhelmed that they couldn't take the amount of phone calls from 8 to 5, and they just could not hire and keep enough staff members. And then in this case, they had a huge bilingual issue that not all their members were bilingual. So now you had to wait, for the Spanish speaking person to get off the phone, and that was not. So, kind of what we did, which is kind of cool, we said, you know what, we can do this through Cassie. Cassie is an
Okay, so
agenda.
that's Cassie right there. She has an actual I don't know, not a body, but like she has a presence,
Yeah,
or
so
it
you
has a presence.
yeah, so you're going to see her in action, right? So what we
Okay.
did is she is live on the now website of the clinic when it comes to patient service, medical records, disability. And I'm going to show you that in a second so you can hear her speak, right? You can add as many languages as you want. They chose Spanish because of the Texas demographics. And this is what's kind of cool is I always love to sell stuff that has an immediate ROI, return of investment, right? It's very difficult to go to a hospital CFO, right? Because he gets sold every day by doctors
Yeah,
that,
and
hey,
his margins are tight and cash flow's tight worse. So I mean, he has to be careful with what he spends money on.
yeah, so the average hospital is 3 to 5% margins. And those expensive toys like the Da Vinci robot, they're for the doctor. So how we sell and price our product is very easy to understand from a release of, from a return of information. So the first thing we did is we were able to reduce the lag time it took a patient to receive it from 15 days to 48 hours. And then we also activated their cell phone. So now they get a text message on their cell phone saying, your records are ready. We give the URL code and they can download them on their computer. And that has been a huge satisfier for customers.
Yeah, you're sort of meeting them. Well, not sort of. You're meeting them where they live. Everyone's on their cell phone, texting each other. So now their doctor is right in that band too.
Yeah, Vic, and we look at the IP address of the device that pings us because we use that as for transfer of custody in case people want to know, hey, who's viewed my medical record? And we're finding out that 80% of people that are accessing our application is done by a smartphone. And it's 80-year-olds, right? It's not,
Yeah.
80-year-olds to 20-year-olds. And then this is the beauty of it, from a value proposition. Right now, the average healthcare worker is about $70,000 on a staff level to healthcare, and that is about $20 to $22 an hour. Unfortunately, benefits are very high in healthcare; they're close to 30%. So 70,000 is kind of what we would average, or I would average when I was a CFO. So in this office alone, we've been able to redeploy, not get rid of because they need them in different places, but we've been able to redeploy 1.5 FTEs, which is
Yeah.
about $130,000 a year. And that's from day one, right? So the moment that you turn on our app, because it's SaaS based, you're saving money. And what's kind of cool is this is not money that needs to be approved by the CFO. The CFO has already approved the budget as part of the labor. It's just that manager in that office cannot keep labor, right? So a lot of times we kind of go into the office manager and say, hey, you have 5 receptionist job opens. What if you hire 4 Cassies and leave 1 human in the loop and try it out?
Yeah. Yeah. So what is so it's saving $100,000 a year or so, maybe 120. I don't know. I can't do the math. And what does Cassie cost? Or how do you
Yeah.
price it?
Yeah, so so if you go to our website, which is very simple, it's humanate.ai, we have a pricing tab by an agentic accountant named Joseph, right? So he kind of looks like a
So
very much
he'll walk me through the process on your
he'll walk you through
website.
the process. So what Joseph would ask you is, what are you paying that person per hour, and what are your benefits? And what we do is we model the pro forma, and we start at 50% of what you pay that person, plus we guarantee 30% more productivity because we don't take breaks, we don't take lunches, and we don't have PTO. So
No.
so what I always say is you can cut your labor in half with 30%
Yeah.
more productivity is kind of like our tagline.
Yeah. And that's a pretty easy pricing model. I mean, whatever you're going to pay your receptionist, half of that is what Cassie would call roughly. I mean, just for me to easy remember. Yeah.
And not only that,
and how, so can I listen to her? How does she sound?
yeah. So I'm going to do I always stay away from live demos, but let me do a live demo with an actual customer so you can see that this is not a gimmick, right? Which is kind of cool. So I'm going to take you to one of our customers' website. I cannot complete the process because if not, I'll be generating a request to them. But let me quickly do that for you.
As you're doing that, how long have you been, when did you start the business and how long has it been in market where you actually had a product?
Yeah, so we incorporated as a Delaware C Corp in March of 2023. So it's been a little bit over 2 years. It took us a year to get the product out of the lab and make sure that it was safe and no bugs. And we introduced it in March of this year, and is generating quite a bit of orders already. So this is a website. This is Carroll Clinic that I was speaking to before. They have 90 orthopedic doctors with their own ambulatory surgical center. As you know, orthopods make their money in the OR, so they want to be as efficient as possible. Therefore, they don't like filling forms. You can see here how they just have doctors and doctors and doctors, right? So somebody has to support those doctors. So whenever you go to their website, all you got to do is go to request medical records or FMLA. You request the medical records, and there's Cassie. Now, they chose a different Cassie.
She's dressed different. Or she actually is different hair too. Maybe.
Yeah. So it's a different character. That's the one they choose. You can choose the gender and the ethnicity. We also have caricatures for pediatrics. So then the first thing you say is, okay, I want English, right? And you say, okay, give me all my medical records, right? You pick your language, English, and hear her out.
Hi, my name is Cassie. Welcome to Carroll Clinic Medical Records. I'm here to guide you through the process of ordering your medical records. To place a request.
Yeah, I mean, it sounds like a human. It sounds like anyone, really.
Yeah. So it's kind of funny because I read the reviews every morning, and patients told me like, "Hey, I feel like I'm talking to a real person." She is much better than filling forms.
Right.
So, for example,
now, I'll ask you for some basic information.
So then, as she's collecting your information, it becomes a Chat GPT experience. So you can either type it or you can say it, right? And if you say it, she also does the verification whether you're putting your date in the proper format. We also ask you for your permission to take a picture of you, so we validate your identity by comparing your picture to the one that you gave the doctor, during registration. We also capture your consent for releasing the medical records. And afterwards, we send you a text message saying, hey, this is your tracking number, like FedEx, so you can log in and track the status of that. And that is much better than having to call in the practice every day and say, hey, do you have my request?
Right.
So we find that this is a great experience. I would say that 80% of the people like it, and stay with the program. We also let them opt out and try to call, but 80% choose to stay with it. And you always hit the wisecrack about, hey, is Cassie single? Because she looks so real, right? It's like, is Cassie single? But I would say that what I find meaningful is when a non-native speaker says, it's the first time I felt understood, right?
Yeah, right. Especially, I mean, Spanish is, I think, reasonably prevalent across the healthcare industry, but once you go to any other language, it falls off dramatically. And so if you happen to speak, you said Pakistani earlier, that's going to be a lot of work to try to find someone in the healthcare industry that can speak with any level of fluency. But a lot of the communication in healthcare is fairly nuanced. It's not like your restaurant travel vocabulary. So you need to know much deeper.
One of my classes I took was in international marketing, and it really taught you about words have different meanings, right? So when they were marketing a vacuum cleaner, Hoover, in Latin America, their tagline is like, nothing sucks like a Hoover, right? You know, and then in healthcare, you know, the campaign "Got Milk" got translated in Latin America to "Are you lactating?" Right now, you know, so think about that, right? So those are the nuances, you know, in a different language that, you know, that hey, it hurts when I urinate, you know, that might be something very personal that I need to tell you in my own native language. And it's kind of cool, you know, I'm a native Spanish speaker. I learned English at 12. And what's interesting is we didn't pick, you know, Spanish from Spain. We didn't pick even the formal Spanish in Mexico like usted. We went with two, which is very informal because that's what Nicaragua, Guatemala, right? So you have the ability to make sure that you're speaking to your audience and meeting them where they're at.
Yeah. Okay. Now I know you have a partnership with NVIDIA. What is involved in that? I mean, that's a huge $4 trillion business. What are they doing with little but growing Humanate?
Yeah. So I'm a believer that there are times, you know, there are times in your life where the technology stars line up. And let me give you an example. Two seminal events happened. One was Steve Jobs said, "Hey, this is the iPhone." And at the same time, Jeff Bezos says, "Hey, I'm introducing AWS." And I look at how disruptive those two things have been. And, you know, everything has gone to an app, right? So a couple of weeks ago, I got invited to go to Google. They were touring me Google Maps, right? So this is where Google Maps occur. And I started thinking, I remember traveling with my dad with an actual paper map.
Yeah.
Then on my own, I got a Garmin GPS, and now I don't need that because I have an app. You know, well, I really feel that the future is going to be agents on your phone, not apps anymore, right? And that's kind of where we're getting to, that you have your own AI agent that advocates on your behalf whenever you need to see a doctor, whenever you need to refill medicine, you know, from that standpoint.
Okay, that's interesting. So you're right now you're putting the AI agent to represent the doctor's office, that orthopedic doctor. And so any patient that comes in, the same AI, Cassie is its name, interacts sort of on behalf of the medical group. But what you just said, I hadn't really considered before, that you might have an AI agent in your phone that sort of helps you with your own healthcare over time.
I'll give you an example, Vic, and again, respectfully, I'm not trying to be provocative, but the way they sell us EMR in healthcare is that, hey, you're going to capture your clients and you're going to have your own referral system. Therefore, no one leaves your system, right? So let's say that I go to my doctor and he or she sends me to do imaging. You know, the EMR will try to schedule you within that healthcare system. And now I find out that I have a spot, you know, a cyst, a spot on my kidney, and now I need to go to a nephrologist or a kidney. Why do I need to stay within that system if maybe the best nephrologist in my city is not part of that system? Well, Cassie can determine that. Right. And I'll give you an example. You know, when I was at Baylor, I looked at the cardiothoracic line because of Dr. Michael E. DeBecki and Dan Cooley, and I would find that some cardiothoracic doctors had 2% mortality and some had 0.2, which is huge disparity. But you and I as patients never knew that. Why do I need to go to a doctor that has a higher mortality? Right. So I really think that these agents are going to advocate because they're wonderful search engines, right? That can look through data and say, hey, from what you told me, this is your best choice.
Yeah, so I agree that's coming, but talk about what you do with NVIDIA right now.
Yeah.
What do you have in mind with them right now?
So let's talk about NVIDIA. So the two things that technology has lined up is, one is OpenAI ChatGPT. That's a total experience of being able to search by voice. The other one, you know, Vic, that is huge is GPUs taking over CPUs as the most powerful part of a computer, right? I remember when Texas Instrument introduced a transistor on a semiconductor, and that was, you know, that was huge, right? Well, the combination of ChatGPT and NVIDIA has been wonderful. NVIDIA took us on as an inception program because they want to incubate startups in the AI because we buy more stuff from them. Well, what are the kind of stuff that we buy? We buy computational power because it's about $200 an hour to train, to train an agent in a GPU Blackwell H200. So one is they're giving us steep discounts and credits to be able to use a computational power. Second is they have, for us, the best LLM. So in LLM world, large language models, size is not the most important thing, right? So I tell my customers that we are 30% more efficient than ChatGPT. It doesn't mean we're better. It's just that we restrict Cassie to only pharma and healthcare terminology.
Yeah,
And
she can't talk about I don't know, astrophysics or something.
yeah, so if you ask her who's the better, the Yankees or the Red Sox, she's going to say, I don't know what you're talking about.
Right.
But you ask her about a protein molecule,
medicine or pharmacological products or anything like that, anything in healthcare, she really knows it.
Yeah. And then the third part of what NVIDIA has done for us, and we're very grateful, is that they put us as part of their venture capital ecosystem, who's run by Howard, a Stanford grad. So once a month, I get coaching from NVIDIA, and they bring different venture capital firms. And it has helped me a lot in terms of perfecting my pitch.
Yeah. Now, how many startups do they work with? Is it like hundreds of startups that they're working with now?
It is, but they're huge, right? But I want to show you something that I felt that it's almost like dating. I kind of felt like we went past the first date, which is a startup. And let me show you what I mean by that, because this really has kind of put us on the map. So they had called me. NVIDIA has an annual show in their headquarters in Santa Clara called GTC Show, and it's attended by 30,000 people a day for 4 days, and it sells out every day. And they had called me and said, hey, for our startups, we offer you a booth, but it's going to be in the startup section. You have to go under the stairs, and it's going to be in the corner. And I said, well, I'll take that, right? Nothing wrong with that. And then they called back and they said, what Jensen Huang wants to do is pick 5 startups, 5 in computational power, so we're pharmaceutical companies, 5 in physical AI, which is robotic surgery, which is a big one, and then 5 in agentic. So we were only one of 5 companies in the agentic, and we were right across the from them. So we got a lot of traffic. One of my highlights is I got to meet my hero, Jim Cramer from MSNBC.
Oh, nice.
Kimberly Powell from NVIDIA brought him over and he interviewed me, from that standpoint. But let me show you kind of the, kind of what happened there, which I think you'll enjoy. Okay, so this is an actual photo to be made look like a Polaroid. So there's Kimberly Powell, who has been with NVIDIA for 17 years. She's a MIT, Stanford, Northwestern grad, highly accomplished.
Yeah.
And this is March of 2025, so not too long ago. So she does a keynote saying that the agentic AI agent ecosystem is going to reach $1 trillion in healthcare, and that's with a T, $1 trillion. And then she announces they're partnering with 8 companies. And these are companies that we all know of: McKinsey, Deloitte, Accenture.
Yeah. So if people that are listening and not able to see it, Kimberly's on stage at NVIDIA's event, and behind her there are 8 companies. And it's McKinsey, Deloitte, Accenture. And then, Carlos, what's the other one up there?
So Humanate, right?
Humanate.
And since that happened in March, Vic, my phone has not stopped ringing.
Yeah.
Right. We signed a contract with 50 orthopedic clinics, all different. We signed a contract with the largest healthcare system in South Carolina, 23 hospitals. And it just continues to gain momentum.
Yeah. So I want to talk to you about your sales and implementation process. You have a really interesting approach to how you respond when someone calls you and says, "Hey, I'd like to consider this for my practice or my health system." Talk about your trial process.
Sure. No, and we did that out of experience and necessity. If you talk to any pharmaceutical rep, what they'll say is that the gestation period between your first meeting and when you get a contract can be up to 1 year in a hospital system, maybe in a clinic is 3 to 6 months. So it takes a long time to get vetted because it take you from department to department, and you could go from IT security to now procurement to legal. Now the chief medical officer has to weigh in. And a lot of it is you're kind of waiting on contracts. So what I did is I said, let's go back to a handshake, right? And I limit the risk and exposure to them. So I say, hey, you don't have to sign a contract with me. So what we do is we sign a scope of work, meaning this is the work that you're asking me to do. You want a medical receptionist, you want you want a medical records, you want a billing specialist,
whatever. More like clarity, kind of just clarity of what they're looking for.
Yeah. And then what we do is we offer them a 60-day free trial, right? Where we go in there for a week, install the equipment, train them, and kind of babysit it for the first 2 or 3 days where patients are in, and we take surveys. And what I tell the decision maker is, in 60 days, I'm going to come back and 3 things can happen. One is you don't like it, and I'll take my Cassie back with me on the plane. Second is you like it, and I'll sign a contract. Or third, you might like her so much that you want 3 more. And one of the key KPIs for my company is the conversion from trials to contract. And right now we're running 95%, right? So as long as we can keep those metrics, it's a great way to kind of ease the concern about AI. What if people don't like it? Is it only...
Well, and you get to really, it's like test driving a car. You get to really try it. You see people walk in and try it. You try the internet, whatever, and then they know if they like it or not.
Yeah. So I'll give you another example. We're working with a healthcare system that sends an email for patient satisfaction scores. And they were getting less than 4% responses, right?
Yeah.
We put Cassie as a kiosk during checkout, and we've been able to increase that to 70% of people stop in and just spend less than a minute saying what they thought about their visit. And it's not just rate from 1 to 10. It's things like, tell me who went out of the way to help you. And people are surprised that it was not the doctor at times. It was that medical receptionist that helped them get to the right insurance card. It was the valet person that got him a wheelchair, right? So it's able to capture text by voice. And I think people are learning a lot more about the experience of the patient when they go. It takes about an hour for the whole experience to go to a doctor, and it's less than 10 minutes with your doctor. So we are saying, tell me about the other 15 minutes. Were you able to find parking? Were you able to pay? Were you able to, this? And so I think we're giving a more holistic view of the patient experience.
Yeah, excellent. Well, so I have another question. A couple weeks ago in the roll-up show, Marcus and I were talking about OpenAI's data exposure. So I don't know if you know, but they hold all of their chats in history, and Sam was on record. He intentionally went on record telling people to be cautious because if you're in a lawsuit or whatever, it's discoverable. The law enforcement or the other side can get their chat records from OpenAI about you planning to do whatever, learning how to break into a bank or whatever it is. And Marcus and I were talking on the show about a lot of people are sharing behavioral health things, physical health things, very intimate health details with their AI because it is very useful. and they can't reach their doctor or whatever. It's late at night and they want to do it, whatever the various reasons are. And that creates a pretty big data security risk. So how do you're handling a lot of healthcare data. How do you manage this in Humanate? Do you have that same thing or have you solved it?
No, absolutely. I think, I think we have a very robust solution that can withstand, all the cybersecurity and hacks that are happening. So let me give you a couple of things. First of all, we do not store any data. So when you look at, HIPAA, which governs privacy, right? We do not store any data because it's almost like printing a piece of paper. Once you print a piece of paper, it's a breach about to happen if somebody finds a piece of paper. So we do not.
So when you're doing the intake, you're talking to me, you get my history, you fill out the electronic medical record in the doc's office or in the hospital, but Humanate is not itself holding any data. So it's the same data risk that I would have at any health system. My data is in the health system, of course, but Humanate's not holding it.
Yeah, and we go even beyond that. So check this out, Vic. It's kind of cool. So you go up to her if you choose to get it through a kiosk, and she'll say, "I'm Cassie. Who are you?" I say, "I'm Carlos." She will always remember your name and call you by your name, Carlos. But as soon as that interaction is stopped, we erase her memory. Right? We fully erase her memory because we don't want the next person to say, "Who was that and why were they here?" She knows that. Right? She knows that hey, I'm there because I have shingles. Maybe I don't want people to know that I have shingles.
Yeah.
Right?
And does Cassie recognize my face, or is she? How does she know it's still me?
Yeah. So we're working on different identities right now. What we do is there's a part of the medical record called a master patient index. That's the most accurate file that has your information. It's 8 demographics, name, sex, age. So what we do is we have an algorithm that lifts it from the federal ID with the driver's license, and we got to match all 8 criteria, right? So we match that criteria in your medical record to the criteria in that. And what's kind of cool is because she is smart, if she notices that you have a different address, she'll ask you, "Hey, which address is the most current?" And you say, "Oh, I just moved." She'll congratulate you for moving and hope that you like it. Same thing with getting divorced, changing your names. And we're able to then correct the information within the firewalls of the client's database. So we don't collect any data. We always transmit the data back inside the firewalls of that EMR. Right. So whatever.
So it's actually maybe more secure than the human way, right? Because the human doesn't wipe his or her memory with every patient walking by. They respect it, and most of the time they don't do anything with it. But if you wanted to be a bad actor, you certainly could. And this is the same thing. Cassie is electronically putting data into the electronic medical record, but then as soon as that interaction is over, her memory is wiped and she moves to the next one.
And I'll give you an example. So when I was in Houston, one of our residents, unfortunately, was shopping late for food. They're always working late, and he got carjacked and got shot. Well, then he became part of the community. "Hey, did you know resident Joe got shot?" And people go, "Yeah, I know Joe. Yeah, he got shot." So people were talking about his medical condition and went as far, because there were also residents, to log into the EMR and see how Joe was doing. Well, Cassie, she might have seen the shooting, but she forgets about it, right? So she isn't able to say, "Hey, what happened?" So you can really, do that in terms of erasing her memory.
Yeah. Okay. So tell me how the 60-day trial has worked. Where are you? You said something in South Carolina, you having good success. And then what kind of practices, or what are the ways that people are using Cassie, or maybe you have different personalities too?
Yeah. So we're calling ourselves staffing as a service, almost like a play on words on SaaS, right? So in some ways, when you look at our website, again, humanate.ai, is you get to pick your character. You tell us what kind of character you want, and then you go to their resume or you go to their job description. They'll tell you what all he or she does, and then you can also look at the resume and see where they're working. So it's almost like hiring a candidate. So you say, okay, well, this is what she does because that's a job description, and this is where she's working. So you can call and see how the referral.
What does that mean? Where she's working? Like, I guess
where she's currently deployed at a
okay,
current.
yeah. So like that was it Carol or something related to that
Clinic.
orthopedics. So
Yeah.
Cassie is working at Carol Orthopedics doing A, B, C, and D as a receptionist.
Yeah, correct.
Yeah.
So in some ways, right now, we try to stay away from any credentialed jobs. In full disclosure, I'm the only non-doctor in my family, meaning that I have two brothers that are doctors. And I can tell you that if somebody goes into my brother's exam room and he's a Mayo trained surgeon and says, Dr. Rodriguez, this is what's wrong with me and this is what I need, he gets incensed, right? Because he says, I went to school and now you know more than me because you Googled,
Right.
the website. So we stay away from medical decisions. Now we're able to do them, and maybe in the future, but we think an entry point that is highly sought by doctors and nurses is to have a full staff, and
Yeah.
they don't care if it's digital or humans. And at times, digital perform better because they show up every day and they have no bias. They have
Yeah,
no
I mean,
bias.
if I think about the doctor friends of mine that they have incredible turnover in their non-credentialed staff. Almost always they have open. I guess that's obvious. They have job openings. And so what you're saying is let us help you fill that need and get your patients taken care of faster. And it actually probably drives more throughput through their system. They can see more patients, I would think.
Correct. So, for example, the university that I'm next to, we get our money from the state for rural healthcare. So we're supposed to stay on our lane of rural healthcare, which is a huge issue, as you know, with rural hospitals and clinics. So therefore, one of the hardest, clinical lines to access rurally is adolescent psychiatry. So now A&M has a telemedicine behavioral program that even teachers can call and say, hey, little Johnny's acting a little bit differently. Do you mind doing a 30-minute evaluation? Well, they did 260,000 evals and ran out of doctors. So we said, hey, let's help the doctor and we'll conduct the health and physical. So we get on the screen before the doctor. We read from the medical record how you answer anxiety, depression, self-harm, and so forth. We ask you those questions, score them, and then send them to the doctor before they get on. And what we find out is that people are more honest with Cassie than they are with a clipboard or a doctor. So if you disclose that you had an alcohol or a drug problem, and we say how many drinks a day you're having, we've followed up and find out that people are more honest with Cassie than they are with their provider.
Interesting. Okay, so now, Carlos, give me a sense for where you think this is going, like both at Humanate and for the industry overall. It says on this slide that we're looking at, NVIDIA thinks it says a $1 trillion opportunity, which seems incredibly large. Where are we all headed with AI in healthcare? What is you're close to this. What do you see? What should I be looking for? What should listeners be looking for the next, say, 12 to 24 months?
Yeah, great question. I think AI is perfect for healthcare because it's almost like when Southwest came out, they said, hey, we'll give you better service at a cheaper price, right? It's the same thing with AI. It gives you better service at a lower price, right? So you don't have to compromise one for the other. So when it comes to things that patients need to access, their healthcare, whether it's a doctor's appointment, whether it's a refill, asking for a referral, or in the other way from a payer, think about, we have groups of people that all they do is answer denials. 80% of collections can be done through AI, right? So I really think that AI will be the first line of defense before they triage it or escalate it to a very senior subject matter expert, right? But you don't need 10 people, you might only need 2 or 3.
Yeah, it's interesting. I mean, a lot of people are scared that there's going to be job loss with AI. And I think, unlike many industries in healthcare, we don't have enough people. We have a shortage of nurses, shortage of doctors, shortage of almost every role. And so I don't think anyone in healthcare that I've talked to is worried about losing their job. They just need help. And so it could be really a good match where you're not going to lose. Receptionists are not going to lose their job. We just need 10 times more receptionists to take care of all these patients and get them the help they need.
Yeah. So let me give you one more example. I know we're getting short on time, but I was talking to my brother again, who's a surgeon, and he was very frustrated because he gets paid based on DRG codes, which means that he gets paid based on his productivity. And he says that the chairman sat him down and said, "Joaquin, you need to slow down your operations that are not emergency operations, like colonoscopy and so forth, because we just don't have enough nurses, and they're getting burned out. And travel nurses are now $150 an hour, so now they're trying to go back to that." So long story short is, so I said, "Joaquin, what do you do with your nurses?" And he goes, "Well, before a patient comes in for an operation, I have to sit down my nurse and they have to do a preoperative screen. A preoperative screen never changes. It's always, what medicines are you on? If you're on any blood thinners, you need to get off of them because you can get operated, you're going to bleed to death."
Yeah, and if there are exceptions, that gets referred to the doctor normally.
Exactly.
Yeah.
So I said, "Joaquin, we can do that for you. Ask all those questions, put them on a report, and send it to your nurse, and she will go from a 45-minute call to a 10-minute task." Right. And I can tell you that nurses prefer to be with a patient than to be in front of a computer typing.
Yeah. Okay. So that's pretty exciting. What's the one thing that's not figured out in your mind that we have to try to figure out as an industry to unlock this?
A couple of things, and to me, it's more around what you say around privacy. Right. So we on purpose, because of my previous experience with medical records and release information, is I try not to keep data. My concern is the last 20 years, the internet has grown by reselling our data. Right. And we got to get away from that model that, that model that, hey, if I don't get charged for the service, I am the product. Right. So, AI is going to know a lot about you, but you got to make sure that it works for you, not for anybody else. And there's a state out there that is trying to pass the opt-in law. If you look at all of our apps, it tends to be, hey, read the fine print and you can opt out. It ought to be the opposite, and that is that you need to opt in if you want your data to be resold or shared with anybody.
Interesting. Okay, excellent. Well, thanks for doing this. How can listeners find out more? Mention the website one more time. I know you said it, and then I'll put it in the show notes, but then maybe do you have a LinkedIn or email, or how do you like people to contact you?
Yeah, so Humanate AI is the best way. It has all of our contact information, so we'll be happy to schedule a demo with you. Okay. From that standpoint, we do have a LinkedIn page. But I would say that Humanate AI will get to me within 48 hours.
Yeah. Okay. So Humanate's HUMANATE.ai. Is that correct?
Correct. Yeah.
Okay.
And it's not a word, but the invocation is to make something more human or more human-like, right? So we call Cassie the clinical care concierge because we want her to be a concierge. And I don't know if any of our viewers are in concierge medicine practices, but you know what I'm talking about, that if you have a concierge medicine, there's a lot more thorough follow-up.
Yeah. Yeah. And kind of bringing that really in-depth follow-up, attention to detail and patient care to the broader industry is pretty interesting vision.
Yeah. Yeah. And what our CMO, we have a chief medical officer, says, Carlos, one of the hardest things about being a doctor is everything you have to remember up here. And he says, by having your technology, I don't have to have everything up here. And he sees it as a great advantage that he can reference different things.
Yeah. Excellent. Well, Carlos, thanks for doing this. Super excited about what you're building with Humanate.
Thank you, Vic. Appreciate it. And I'm here to answer any questions as a follow-up.
Okay, great. Thank you.
Take care. Bye.